mynews.studio.
A single injection every 2 months could reshape the fight against HIV. So what's holding back its global rollout?
Today is 2025-08-28. The World Health Organization has just endorsed its first ever long-acting HIV prevention injection. That's a turning point. But I keep wondering, why now? And what does this mean for global health outcomes?
It's a significant development. On July 14th, the WHO updated its guidelines to recommend long-acting Cabotegravir, CABLA, for pre-exposure prophylaxis. This is the first time a preventive HIV injection has global backing. The science is robust. Clinical trials show Cabotegravir outperforms daily oral PrEP, especially for people who have trouble taking pills every day.
That's interesting. Daily pill regimens have always been tricky. People forget, and there's stigma. Not everyone can get access either. How much more effective is this injection, and for whom is it the most game-changing?
Clinical studies show Cabotegravir injections given every 2 months reduce HIV infection risk more than pills. The benefit is biggest in areas with high HIV rates, like sub-Saharan Africa, where sticking to daily pills is harder. Plus, for people worried about being seen taking PrEP, getting an injection offers privacy.
But if the evidence is so strong, why isn't this rolling out everywhere already? What's stopping it?
Good point. Even though over 50 countries have approved it, access is still limited. Generics won't be available until at least 2027, so cost is a barrier. Then there's the challenge of supply chains and healthcare infrastructure, especially where the need is greatest. The WHO's new guidance, like simpler HIV testing and community delivery, aims to help, but scaling up takes both time and money.
So it's not just about having the drug, it's about making sure it reaches people who need it. What's being done to speed things up?
The manufacturer of VIV Healthcare has licensed generics through the medicines patent pool, which should help with affordability in the future. Meanwhile, groups like WHO and the Global Fund are working with governments to get faster regulatory approvals and bulk purchases. Another piece is training healthcare workers and community groups so they can deliver the injections and share information.
I'm also wondering, could this injection help reduce the stigma around HIV prevention, especially for marginalized groups?
That's definitely one of the hopes. Because it's private and only needed every 2 months, it can make people feel less exposed for using HIV prevention. In real-world settings, people are sticking with injections better than with daily pills, which could mean fewer new infections overall.
But I'm guessing there are still some ongoing challenges even with this breakthrough?
Yes, there are. People can miss doses or stop early, which can reduce effectiveness. That's why ongoing support, things like reminders and community outreach, are still important, especially for those at risk of dropping out.
So, not a magic bullet, but a major step forward. Why does this matter so much right now on a global level?
HIV and AIDS are still major causes of death, especially in marginalized communities. What's different now is that this isn't just a new drug. It's a signal that prevention could become more accessible, less stigmatized, and more effective. It might change how public health systems approach epidemic control.
And if this works, could it set a precedent for other diseases or prevention strategies?
Absolutely. If long-acting prevention works for HIV, we might see similar models for things like tuberculosis or hepatitis. The lessons here could shape broader public health strategies.
So, to sum up, WHO has recommended the first long-acting HIV injection. It offers better protection and fewer barriers than daily pills, but making it widely available means overcoming cost, supply, and education challenges. The stakes are high, not just for HIV, but for the future of disease prevention.
Exactly. This isn't just a scientific advance. It could be a turning point for public health policy.
Thanks for joining us as we unpacked the rollout of the world's first preventive HIV injection. Could this be the beginning of the end for HIV as a public health threat?
That's the question we'll be watching in the months and years ahead. Thank you for listening. This episode was powered by mynews.studio. Try now for free.